Good morning and welcome to the Windsor-Essex County Health Unit's media briefing for December the 23rd. We will start today's briefing with some opening statements from CEO Nicole Dupuis, and then we will move into our media questions. Thank you very much. Go ahead, Nicole.
Good morning, everyone. Our health unit has taken a leadership role in coordination of local enforcement agencies as it relates to the provincial Reopening Ontario Act. Over the past year, the WECHU has convened and chaired a regional enforcement committee consisting of municipal bylaw, police services, and provincial enforcement bodies to ensure consistent enforcement across the municipalities of our region. As we are early on in the introduction of new restrictions, which are enforceable by any provincial offences officer, we will continue to lean on the relationships to maintain a consistent presence in our community over the holiday season. I want to start by thanking Windsor Police Services, LaSalle Police Services, our local OPP detachments, as well as each of the municipalities' bylaw enforcement officers and our ministry partners for their ongoing commitment to keeping our community safe. Been asked a couple of times, this past Saturday, the health unit partnered with provincial offences officers from multiple Ontario ministries to conduct an enforcement blitz on the eve of the new restrictions being put in place by the province, which went into effect for the 19th of December. This collaborative effort, which we have undertaken several times prior, resulted in 69 visits from 14 officers to restaurants and other businesses, primarily in the City of Windsor. Over the course of the 12-hour enforcement campaign, 9 tickets were issued and 21 businesses were coached towards compliance. Primary infractions noted were related to long-standing measures that have been in place, such as active screening at the entrance of the businesses, a lack of documented safety plans, and the improper use of eye protection. And I know this is something that we have shared many times. To say that it's concerning would be a bit of an understatement. These measures, such as screening and proper use of PPE, have been in place, for well over a year. I do want to thank the officers and inspectors, in particular at the Windsor-Essex Health Unit, who have faced some of the most challenging and difficult circumstances across our entire agency during this extremely challenging year. And I want to express our sincere appreciation on behalf of the entire community to those responsible business owners who have sacrificed, adapted their business models, and continue to make the tough decisions needed to prevent the spread of COVID-19. We know it's not easy, but the measures will hopefully break the chain of transmission and preserve the overall capacity of our local healthcare system. Thank you, and we're happy to take questions.
Thank you. We will start with questions from Blackburn.
Hi, Nicole. I wanted to ask you, you mentioned that these are long-standing requirements that have been made of businesses, and you mentioned that it's concerning. What kind of excuses or what reasons did they give you for not having these things in place?
So I couldn't tell you what the conversations are between the officer and the businesses on the ground, or what reasons that they're giving. I know in some communications I've had, sometimes it's that they, businesses weren't aware. Those are generally the sentiment. In particular, I know eye protection, there's been some confusion over the requirement to wear eye protection. And so we, as a health unit, have put out many memos, in particular targeting certain businesses where there seems to be some confusion, just to ensure that everybody is aware. The eye protection is both the Ministry of Labour, but is also identified in the Reopening Ontario Act that where a worker is within 2 meters of someone not wearing a mask, they have to wear both a mask and eye protection. So for example, restaurants and bars, your server is often going to be in 2 meters of someone not wearing a mask. And so that requirement is something that we, do see over and over again and continue to reinforce.
Was there anything out of today's epidemiological summary that caught your eye?
So we don't have a summary this week, Adele. So other than, I guess, to say we're still monitoring our numbers, we have overall sort of hovered around the same, at least for the past 7 days, around the same cadence with our cases, around 100. But we don't have our usual summary this week.
Okay, thank you.
Any questions from Windsor Star?
Yes, good morning. Nicole, you said that the WECHU officers have experienced some of the most difficult situations out of all of your team. What kinds of things have they expressed to you that they've experienced?
I think we've talked about it before, and I think the whole team at the Health Unit has gone through some trials and tribulations, certainly throughout the pandemic, and it has been stressful for everyone. But certainly our enforcement officers, they are in the front lines, and not always, sometimes in situations where I guess they're not as collaborative as we would like, and certainly they can be some difficult conversations, and without going into too many details, certainly I'm sure you can imagine for enforcement officers, it's not always happy engagements and happy conversations that they're a part of when they're trying to enforce the rules.
And separately, this is the last time that we'll be speaking as a teleconference group, and before the holidays. You've mentioned these things before, but what are your final really important messages to the public as they may be considering gatherings and celebrating their holiday season?
I think I'll turn that one to Dr. Necessary for his thoughts.
Yeah, I think that my suggestion is more than anything to if you're sick, don't go to a holiday party or don't go to a holiday gathering, and to keep the number of restrictions to 10 people indoors and 25 people outdoors. I think those are two key items related to the holidays moving forward. I think the general measures still are worthwhile: to wear a mask indoors, to wear a mask if you cannot stay consistently 2 meters away from another person. If you're sick, stay at home. Wash your hands frequently. Those general public health measures, plus the specific guidance that we've given on social gatherings, I think are important during this holiday time. I also think it's important that people try to live their lives as best as they can throughout the holiday season. And although there are restrictions on the number of people who can gather in person, there's no restriction on the number of people who can gather virtually. There are opportunities to call and have dialogue with family members that perhaps you've not had interactions with in more recent times. So as best as we can, we have to, as a society and as a culture, we have to live our lives as normal as possible, but also recognize that we have to follow the restrictions as articulated in the public health letter of instruction.
And if I can just add, just for people to think about, it's not just a single social activity, but it's also the collection of activities that individuals are engaged in a short period of time. So, just I think we'd ask that people really consider that. So, and reduce as much as possible the amount of, again, human to human contact during this time, and think maybe about spreading out. If you are engaging in any kind of social interaction, ensuring that you're spreading that out, reasonably so. And as well, we'll just also reinforce that we are going into the holidays, and I know we've said this multiple times, but individuals who do test positive, if you're sick, stay home, get tested. If you do test positive, you will receive a call and be asked to inform your close contacts. So making sure that people have a good understanding of who their close contacts are. And just for those who are close contacts, to understand that they won't be receiving a call from public health, but we have a lot of great information on our website that provides direction and instruction for self-isolation.
Thank you.
Any questions from AM 800?
Nicole, just going back to Taylor's first question in regards to staff being out there. I know in October you talked about how there was increased threats and abusive language towards the staff members. I think after that came out, I asked you maybe a month later how things were going. You said it was improving. I guess with these new restrictions that our local health unit put in place and the province now put in place, has that changed? Is there more, I guess, frustration out there towards, staff?
I would say our enforcement officers, I wouldn't say overwhelmingly every time, but they definitely do face frustration and escalation and frustration. And anytime there's new restrictions or changes, they do bear the brunt of that. I would say in the community, they, again, are on the front lines. They're the face of those restrictions. And so, they have a tough job. The time frame, you're right, when we talked about it in October, I think, again, when we put the measure in a couple of weeks ago, the letter of instruction came out, we do see an escalation in some of that frustrations, abusive language, et cetera. But I think that, that has calmed down a little bit, certainly. But for those who work in the field and on the front lines of enforcement, I think they're always, they do always bear a bit of the brunt of frustration as they are the face of those restrictions. And we just ask people, to understand that they're enforcing, they are enforcing the rules, they're doing their job. And I think I've said this before, to just, meet each other with kindness and understanding.
Thank you. And then last night, the release came out about the mass vaccination center for Leamington. I know we had Mayor Dilkins on this morning. He talked about city staff helping out at Devonshire Mall. I believe he said around 80. When it comes to the Leamington site, will it be health unit staff along with, I guess, municipal staff rolling out in Leamington? Yeah,
we're working in close partnership with the town of Leamington, as well as other municipalities who are willing to support that effort. Primarily, the health unit is looking to staff the site clinically, at least with our staff, and then working with the town for all of the other sort of supports that are needed, and working in close partnership with them.
Thank you.
Any questions from CTV?
Good morning. Was wondering if with the school boards, I know this is the last time you guys are going to be speaking for the next few days, but over the next couple of weeks, I guess, what does the health unit need to see for kids to maybe be back in the classroom in the new year?
Well, it's always difficult to predict the future, and obviously all of us recognize the situation changes day to day. I think in the first instance, the goal is to keep schools open for instruction, and I would urge policymakers to be very reluctant and only consider closure of schools under the very extreme of circumstances. So our goal is to keep schools open for instruction, and in my mind, that should be one of our main focuses. I think a key thing is that we want to break the chain of transmission, and breaking the chain of transmission means that translates into reducing the number of people who are exposed at schools. We've already dismissed more than 800 cohorts of young people, so that's about 16,000 young people. And it's important, I think, during this holiday season for people to limit social gatherings, because limiting social gatherings reduces the risk of transmission. And if there's a lower number of people with COVID, then there are a lower number of people who will have a likelihood of making it to the school with COVID, and that keeps schools more likely to remain open. So the first thing is to reduce the number of people who have COVID in the community. The second is to follow the public health direction related to social gatherings. And number three, to keep our strategy of containment of the schools as effective as possible moving forward.
Would the health unit be in favor of mandating vaccination for both staff and students? I believe something that the school board would be on board with.
Well, the Board of Health has passed a resolution, and I think it is something I think is appropriate, is that vaccination should be included as a requirement in the Immunization for School Pupils Act. So if I could provide some context, Ontario has been at the vanguard of public health practice for most of this century, and the Immunization for School Pupils Act provides a framework for allowing young people to be vaccinated and monitoring their vaccination status. And that has lifelong impacts to young people, because we get a chance to assess their vaccination status while they're at school. And if they're deficient in a particular vaccine, we can provide an opportunity for them to get vaccinated. The vaccination rate for polio, which is covered by the Immunization for School Pupils Act in Windsor-Essex, is, I believe, around 92%. And we can give you that exact number. It's well over 90%. If we can get vaccination rates for COVID-19 to the same level as other vaccinations, that would have a big impact on the management of schools and would mean that we could scale back potentially on many of the public health measures that relate to schools. So I do think it's a valuable public health initiative. The second is, in employers, and we have to think of this as a public policy choice. The reason we're implementing many of these public health measures is because we're concerned that hospital resources will be saturated by people that are sick, meaning that people who are sick with COVID-19 will present to the hospital, require hospital stay, will require admission to the ICU, require a ventilator, and some of them will ultimately succumb to COVID. We already know people are dying of COVID. 2/3 of the people presenting to the ICU, the last time I reviewed the data locally, were unvaccinated people. As a matter of public policy, if unvaccinated people, the 50,000 people or so in this district who are unvaccinated got vaccinated, we would reduce the burden of reduce the burden to the community of managing the hospitalized patients. So that's something that, employers and individuals, people who are not vaccinated now, I'd ask them to consider how they can help the community by getting vaccinated. Employers and other organizations may require under their vaccine policies for people to be vaccinated. And that, I think, will have an impact not only on the people who are unvaccinated, but also on the people who require other medical services, which are being affected by the lack of hospital resources. So my apologies for that long-winded response, but I hope that provides some context.
Thank you.
Any questions from CBC?
Yes. Hi, good morning. So last night, Devonshire Mall was really packed with people, but no one can book their vaccine appointment into the evening. And we are hearing from the health unit and from local hospitals that it's urgent that people get vaccinated and get that third dose, but some might feel like there's not enough options at this time for them. So how are you ensuring accessibility of vaccines and booster shots right now?
So just clarify that hours of operation is one thing that we are looking at, although it does require additional staffing resources to extend. As well, again, Sears is not the only option. The mass vaccination site at Devonshire is not the only option for individuals to be vaccinated. Primary care offices and pharmacies, as well as our mobile vaccination clinics, are all part of the strategy. So when it comes to accessibility, I would say there are a lot of options as well. The Sears Clinic, as you know, operates 7 days a week. So they operate Saturdays and Sundays as well. I guess my response would be that I think there is quite a lot of opportunity in Windsor-Essex. And as we bring on more resources and more staff and have increased capacity, we will look at where else we can go as far as increasing the number of individuals we can vaccinate at any single site, and that hours of operation, extending hours of operation, is always one of those options.
And then with the new sites that are set to open in January, do you have any idea like how many people will be able to get a shot each day, like what that capacity will be like?
I don't have the exact number yet. Again, it is dependent on the amount of staff, but we are looking probably roughly around for those sites around, probably closer to 500 a day, which would be similar to if I think about what we were doing, between 300 and 500 a day is what we were doing prior, at Nature Fresh. More probably closer to the 500 a day, but we can give more exact of what we're anticipating once we have the full staffing plan for it.
Okay, thank you.
If I could just supplement this, and I think this is an important Christmas message and holiday message. We do talk about the unvaccinated, but another group of people that really need to get their booster shots as soon as possible are people that are chronically ill and have already been vaccinated but need their third booster shot. And this includes people with chronic illnesses such as kidney transplant, heart transplant, previously treated cancers, previous chemotherapy, lymphoma, people with diabetes. It's important because people who don't have perfect immune systems are at higher susceptibility to be suffering from COVID if they get infected. The booster shots make a big difference. So this Christmas, if you know someone who's got a chronic condition, a mother or a father or a child, really encourage them to book an appointment and get their booster shot as soon as possible to provide that additional layer of protection for them.
Thank you. Any follow-up questions from Blackburn?
Nicole, I was wondering how many people you would need to operate the Nature Fresh Center and the one that you hope to open soon in West Windsor. How many do you need for each to operate it?
That's a good question for our director who leads operations. Yeah, when it's at least between 30 and 40 per site, close to, but I can give you, we can email you more of an exact number, certainly. But around, I would say roughly around 30 to 40.
Thank you.
Follow-up question from Windsor Star.
No, thank you.
Follow-up question from AM 800.
No, thank you. Happy holidays, everyone.
Yeah. Follow-up question from CTV.
Yes, I have one. Good morning. What is our supply of PCR tests like? The Chief Medical Officer of Health is saying they're limiting testing in the province amid concern that the rising cases will overwhelm testing centers and people are being asked to do their own contact tracing. So a few elements there.
So testing is a provincial function and not a local health district function. Just reiterating what the Chief Medical Officer of Health has articulated. We want to try to preserve testing capacity for the most strategic way. And the latest guidance would be that if you are in fact sick with COVID, that to stay at home, presumptively assume that you have COVID. So if you have symptoms, presumptively make the diagnosis of COVID, and tell the people in your family who are in your family household or in your household to self-isolate as well. The test was not required to make a determination that if you have COVID. In part, some of the activities that were done by the Public Health Service, which might contact and monitor people who've been diagnosed, have been transferred to the person affected. The reasons for that are we want to shift as much of the resources that we can towards vaccination. It is a shift. It is a shift in COVID practice to ask people to make a self-determination without a test, and we recognize that. However, I'd also like to share in the flu, our public health policy is not to test everyone who's got flu-like symptoms. People make the clinical diagnosis, meaning they're based on their symptom presentation at the right time of the year. They make the diagnosis themselves, or they make the decision that they have the flu, and they stay at home. And so, although this is a shift, this is not as profound a shift as one might initially think. We do have to preserve testing resources because there are times when testing is particularly important to make clinical decisions. Nicole, I don't know if you want to supplement that, if there's something more that we could add.
I think you covered it pretty well.
Yeah.
Thank you. Any follow-up questions from CBC?
Yeah, I know you've kind of talked about this in past briefings, but are you concerned about what COVID-19 might look like here locally after the holidays, and how is WeCHU preparing for a further or possible further surge of cases?
Well, we are concerned that the holidays would, the Public Health Service is concerned that the holidays may lead to a greater case counts. But I think that we are also concerned that that potentially higher burden of disease would have greater impact on the hospitals. every option remains open, but the key parts of managing COVID at this point are twofold, or two primary strategies. One is vaccination, and as we vaccinate the population, the burden of disease goes down. And secondly is on containment, which is to try to make sure that people who are sick stay at home and their close contacts stay at home as well. And we would have to devote our resources to primarily those two activities. If it's okay, if there's one comment I can also add to supplement, and it's not directly to your question. We face questions and we face inquiries about the interchangeability of Moderna and Pfizer vaccine. They are interchangeable. So at this point in the pandemic, I would really encourage people to just get whatever vaccine is available to them at the site that the vaccination center has. So at a pharmacy, if they have Moderna, take the Moderna. At the mass vaccination center, if you're over 30, you'll be offered Moderna, take the Moderna. It doesn't really, from a clinical point of view, it doesn't really matter if you get Pfizer or Moderna as your third injection. It's more important to get the injection and get the benefit of the injection. I know there's a lot of dialogue and informal dialogue that isn't coming from doctors, but from others who talk about this issue. But as a doctor, I would just say get whatever you can get, and that'll provide you the greatest benefit moving forward in the context of Omicron.
All right, thank you. Nicole, did you have any comments that you wanted to make before we close up?
Yeah, I just wanted to acknowledge that today is the last day that our mobile team, small but mighty mobile team, is out at the John McGivney Center. And, I just wanted to thank certainly the leadership at John McGivney for giving up their site this entire week to host a mobile clinic there. And, I think I was asked a question about the number of staff needed to run a site, and they did close to, I think every day they vaccinated close to 500 people with, a very small number of our staff, our nursing team. So anyway, I just wanted to thank them and acknowledge that it's been a really great event out in the West End, and, that they have vaccinated close to 500 people a day, which is pretty incredible for a mobile kind of pop-up site. So I just wanted to say thanks, and they're there again today. So, for anyone who's interested, certainly they can go, and I think they're giving times out. It is not an appointment, but a walk-up model.
Great, thank you. Dr. Nessetheri, would you like to say anything before we sign off for the holidays?
Other than happy holidays, colleagues, and we'll see you in the new year.
Great. Thank you all very much for joining us. Our next briefing will be on Wednesday, December the 19th. We wish you happy and healthy holiday break. Thank you.
19th or 29?
Oh, sorry, 29th.
Okay. Thanks. Merry Christmas.
Thank
Merry
you.
Christmas.
Happy holidays.
Happy holidays.
Happy holidays.